Who's my reader? Anna, good. So
Sure.
we'll come in, introduce ourselves.
Hold on, I gotta pull it up again.
And so Jamie Camp, physician assistant with Gardner University. And one of the things I noticed with the upper that I was a little bit upset about when I graded their well child check was coming over. Yeah, my name's Brian. I'm with Gardner Webb University. I'm a PA student. No. You always give your first and last name. Always. Don't do that next year. I had 2 students out of the 4 I graded that said their first name only, and I wrote some comments. So make sure you say your first and last name. Okay. So we're ready, and so basically come in, sanitize my hands. I would introduce myself, then I'd ask who Grace Anna Perkins is and her date of birth, and make sure it's okay for me to do an HEENT exam on her today. She would give me permission. I'd make sure lighting's good. Lighting's very important for this. And then I'd say, is it okay to proceed with the exam? She said yes, and I'd demonstrate professionalism throughout. So we're going to start with the head.
Okay, head and face. Inspects head and face for symmetry, contour, and deformities. Inspects hair for abnormalities and palpates hair for texture and distribution.
So for purposes of this, can I take this out? Or I actually have her take it out. I want to do it just like I have you guys do it. Maybe you take out, because you don't want to take nothing out of the patient. Let them do it. So have the hair down, and so say it again, I'm ADD here.
Inspects head and face for symmetry, contour, and deformities.
So basically we're going to look first. The first thing you guys want to do is just grab and start palpating. Okay? Let's just take a minute. Look. Okay? Look at her nose, look at her cheeks, look at her chin, look at her face, look at her eyes, her eyebrows, her ears, so forth and so on. Just take a second just to look. Alright? Then start in and actually start palpating the head. Alright? Feeling around. Get a little palpation over the bones. And then making sure that you don't feel anything abnormal. Okay? Nothing magical about this that we're doing. Just kind of palpating over to make sure you don't feel any crepitus, any type of masses, lesions, anything like that, hematomas, tenderness, those types of things that you're looking for. And then hair.
It says palpates hair for texture and distribution.
So then we're going to look at the hair. And so all you guys are doing this, y'all are just going through the motions. But what you really want to do is look for texture. You know, you can look at volume, you can look at color, you can look for infestation. But you really do need to get down to the scalp, because if she's got something going on in her scalp, me just saying, okay, yeah, your hair looks good, you can't see it. So I want you guys really getting into the hairline and looking. I know she can fix it back in a second. And it's really looking. I mean, get underneath the hair, make sure that you're looking and make sure you don't see anything. You guys laugh, but if you're not going to do this in clinic, you're not going to be a thorough clinician when you're actually looking to see if there's anything in the hair or anything like that, okay? So just looking around. All right, and so then she can fix her hair back, pull it up, do her what she want to do. It actually probably would help me if she did pull it back some, but if she don't have a thing, that's fine. So next.
Palpate head and face for masses and tenderness.
Okay, that's what I did
Palpate.
prior. I'm sorry.
Yeah, palpate TMJ movement, open, close, lateral.
All right, so 2 fingers, middle finger. Okay, so you're gonna be here and here. Okay, go ahead and just open and close, open and close. So you can kind of see where you want that movement to be. When you push in here, she can probably feel me inside a little joint line there. I'm in her joint line. So I take 2 fingers, now open and close, side to side. And you just want to make sure you don't feel it subluxe or kind of push out or any type of crepitus. Some of you in here may have a little bit of crepitus in that area to where you can kind of hear it popping like. But you're looking for that and or tenderness or pain.
Next is the eye. Test visual acuity, verbalizing one eye at a time, and then both eyes.
All right, so we've done this. What's the biggest thing I told you guys to remember?
6 feet.
How far away is
How far away you are, okay? And if your card's a 14-inch card, if your card's a 6-foot card. Okay, if you're out in the hallway, don't forget they make 10s and they make 20s. So just because you think it's a 20-20 chart, read the chart. There are 10 charts too, which means 10 foot away.
Verbalizes with tests with and without corrective lenses.
All right, we're going to skip the eye and go straight to the ear, if that's okay. Everybody's good with the eye. Having questions on the eye since we've already done that?
Yeah, it's all the same.
Okay. Y'all just want to get
Dim the lighting before the fundoscope. Oh, you already got all that. Okay. Ear. Inspects the auricle for deformities, discharge, lesions.
All right, so what we're going to do here is look at the ear, okay? We're going to look, and remember, we're going to peel back. If her hair's in the way, I need to get it out of my way so I can actually look. And so I'm inspecting and palpating kind of simultaneously, but you really want to look. In order to pull the ear back, you've got to touch the ear. And so looking here behind the ear, above the ear. All right.
Palpates the auricle, tragus, and behind the ear for tenderness.
So basically, if you do a total, and if they got piercings, just be careful, especially if they're a new one, and making sure you don't feel anything abnormal, but you're not going to hurt the patient. Okay, if it's a new piercing, be careful because they will still be tender from that actually happening.
Okay, the otoscope, use appropriate size for patient.
So they got the adult one. So this is the 4.2, the 2.7 is for the kids. If a kid's 3 or 4 years old, like Jet, when I look at his at home, I use the big one. But the 12, 2 years old, you're probably going to use a 2.7. Okay?
Pulls auricle upward and outward to straighten ear canal.
All right, so up and back for adults. You want to do posterior and back for kids. So here again, there's a couple ways you can do this. I'm going to do it on both sides, so don't panic over there. So if you do it back like this, you better have your palm down to where her face can't turn. Everybody see that? But the way I prefer for you to do it is to hold the ear up and back, get your thumb or pinky finger like that. So she turns, try to turn, Grace Anna. She can't turn, okay? She's hitting my finger. I'm putting resistance on it. And then you want to go down, you want to pull back a little bit, and then look at the ear.
I'm observing the condition of the external canal. Identifies the TM landmarks, malleus, umbo, pars tenna, pars faceta, cone of light.
Okay.
I'm noting the color of the tympanic membrane as pearly gray.
May I, for purposes of a teaching lesson, say something? Is that okay?
Yeah.
Okay.
Oh,
No, say no if you don't want to.
No, I don't care.
She has a scar, so she may have had tubes when she was small. So if you want to see that as clinicians, because if you guys never looked at ears, you won't know what that looks like. I showed you, but she has a scar in this particular ear. That's why I asked if it's okay. Yeah, nothing bad. I would never say, like, hey, guess what? She's got a worm in her ear. I would never say nothing negative. All right, so in the same way here. Now I'm left-hand dominant, if y'all can believe this. This feels more natural than my right hand. I'm all messed up. I kick left foot up, told you guys that. So here, now she's got an earring that kind of protrudes out here. She pulls it forward for me. Here, I got my finger on, and now look, okay? Now, interestingly enough, I don't really see a scar on this side.
Yeah.
Is that true?
Yeah.
There you go, great commission. So, but, so she only has a scar on her right side. So with that being said, looking at the external auditory canal as you go in, just don't get focused on the tympanic membrane, looking for the umbo, the malleus, the pars flaccida, pars tensa, the cone of light, the translucent, pearly gray, all that stuff. Really focus on the external auditory canal and then look. And if it don't come into focus, you may have to pull the ear a little bit. The other big thing that you guys can't do today, because your partner's going to be mad at you, notice when I go in, I'm right there, that's it. I'm not way in here. Look at her face, see? That don't feel comfortable. You just need to go in far enough for that to get in and then manipulate the ear by pulling, and that's it. You guys are going to stick it way far in today, and your person's going to be like, oh, that hurts a little bit. And you're going to say, oh, I'm sorry. But I'm telling you now, just barely put it in enough, okay? All right, next.
Hearing test, performs whisper test, hearing test or finger rub test bilaterally.
All right, so this one's a little different, mine. All right, so if you could, I'm going to have you to occlude one ear, your choice, it doesn't matter, okay? And I'm going to say a 2-syllable word from behind you, okay?
Okay. Popcorn.
Good.
Earwax.
Good. And then if you want to do the finger rub test, then you have her close her eyes. All right, tell me which ear you hear something in. Okay,
Left. Right. Both.
good. So that's just kind of a quick gross auditory acuity. That's not getting any particular hurts or any of that type of thing like we do with the pure tone. Okay, that's a machine. Next.
Nose, inspects and palpate for nasal, tenderness, deformities, lesions, patency of nares.
Okay, if you want to on this, you can get gloves. If you're kind of have a nose issue or touching someone's nose, I would just make a little pig nose or have her make the pig nose. So that's another option you can do, but since I didn't ask her permission, I'll just use gloves. And so when you do this, first of all, you're going to inspect. So I'm just looking at her nose. Many of us, our nostrils are different openings. If you look at my nostril, one's wider than the other nostril. It's just the way it is. And so looking, make sure it's somewhat symmetric. You don't see anything, so you're just inspecting first.
Inspects with otoscope. I'm observing the nasal mucosa and septum.
Alright, so do we have palpate first at all?
Yeah, I read that one.
Okay, sorry. So next thing you're gonna do is just kind of palpate down. Remember, cartilage can go right or left. That's not gonna hurt her, but this bony part here is what we're concerned about, okay? And so after we do that, so we turn our light back on. So you can have your patient make a pig nose. Make a pig nose.
I have a ulcer right here because
Oh, I'll be careful.
stress.
So if she does it, she wants to do like this, okay? And lean her head back. So what you would do, now here's the thing that students really struggle with. Look, you guys are gonna feel bad about like laying it, but you just wanna lay it right on the edge. And I'll be careful since she has the ulcer. We're just laying it on the edge. I'll show you on this side. Thumb.
Oh.
There you go. Lay it on the edge. Do not go up in there. Watch this. If I go up in there, it's gonna make her feel all uncomfortable. We just lay it on the edge, and then you can tell the patient to hold their breath, and then you can actually go in and look. So we'll do this side. Yeah, don't let her breathe out of her nose. Come in here, get really close, and you can look at the mucosa. And that way you can see the blood vessels and everything you need to see. I won't do the other side since she has the ulcer, okay? That's what you need to do. And by holding her breath, guess what that does? Keeps the lens from fogging up. Exactly. So, I've got to remember how to detach this. Yeah. All right. Next.
Sinus. Inspects the frontal maxillary sinus area for swelling. Palpates sinuses. Percusses for tenderness and pain.
So basically, pushing here and kind of pushing here. Everybody see that? Okay. Kind of pushing up and pushing up right there. Okay. If we're going to percuss over, percuss here. Here, I wouldn't do a gloves on, but I'm fixing. And then here, looking for pain or tenderness. Okay.
Oral cavity. Inspects lips for symmetry, color, lesions, and edema.
All right, so here's where I get a little bit picky about how we do things. And there's a method to the madness when you do this. You got to keep a clean hand and you got to keep a dirty hand. All right, so once you've touched the mouth, that hand is your dirty hand. And the reason that's important is you don't want to cross-contaminate your equipment, like your otoscope. So it's kind of like, you got to be very careful with how you hold everything when you're inspecting, okay? All right. So, I have my tongue blade. Still. Sit that right there. Okay. Now, the other thing that I'm big on for a mouth is you got to have a light source. You cannot look in a dark cavity and expect to see anything that you need to see without a light source. Okay? So, that's the other big thing. So, we're going to inspect, correct?
Mm-hmm.
Read that again.
Inspects lips for symmetry, color, lesions, and edema.
All right. So, I'm just looking at the outside. She's not cyanotic, as you can see. Red, pinkish color. She doesn't have any type of drooping or anything like that. Her looks symmetric if you were to cut it in half either way, perpendicular or with a horizon. What else?
Palpates lips for masses, lesions, tenderness with
All right.
glove.
Okay, so yeah, I always have gloves on. But notice I'm just going to use one hand, so this now becomes my dirty hand. All right, so this is going to feel weird, so just hang in there. You're glad you volunteered, aren't you?
So glad.
So basically you just palpate to make sure you don't see any tenderness or anything like that, and you can actually pull out on the lips if you're worried. We'll do that in a minute when we're actually inside the mouth. So just palpating the lips, no masses, lesions, those types of things.
Inspects gingiva for color, inflammation, and lesions.
All right, so now what I'm going to do is take my clean hand, which is my left hand, and my dirty hand, which is my right hand. Light source, this is going to be open. I'm just looking now. So I'm going to look at gingiva along the bottom. Okay, and I can look at the inside gingiva. She's got her tongue up for me. Looking at the floor of the mouth, which that'll be later, but since she was having it up. So as you come across, just kind of raise up. Real easy. Notice I'm not hurting her. I'm not pulling real hard like, whoa, like that. You don't have to go real hard. Just kind of visualize the gingiva, both the back side and the front side.
Palpates gingiva for tenderness.
All right, so now what you can do is, as the patient's holding this, just set that back in there so it doesn't get dirty. Dirty hand. So now what I can do is go along her gingiva and kind of just palpate with my finger. You can also use a two-finger approach like this to go back and get in those areas. And so you go like this all the way around, and then you would do the same way on the top when you palpate the gingiva, okay? Next.
Inspects teeth for caries, loose or missing dentition.
So what I can do here is a couple things. I can use this to do kind of an inspection first, to look for any type of caries along her teeth. And then what I can do is put this back open, and then I can kind of feel to see if I feel anything loose, okay? If I have any kind of teeth that are loose. Now be careful that you trust your patient, that they're not going to bite you. Okay?
Tongue and buccal mucosa inspects color, symmetry, swelling, masses, lesions, ulcerations.
So here again, looking at her buccal mucosa. Lift your tongue up again, looking at the floor of the mouth. All right, and I can actually go and palpate the floor of the mouth, make sure I'm feeling masses. All right, put your tongue down. I'm gonna look at the top, both the hard and the soft palate. Okay, go ahead.
You palpated for masses and tenderness.
Mhm.
So soft and hard palate, uvula, tonsils, and oropharynx.
Okay.
Using a light, inspect soft and hard palate, uvula, tonsils, and oropharynx. Ask patient to say ah, observing for symmetrical rise of soft palate and uvula.
Okay, so they go back. Ah,
Ah.
again, hold it.
Ah.
Okay, good. And this uvula is rising. It's not to one side or the other. Looking for tonsils if they have them. Make sure you're not swollen or inflamed. Looking at the back of the throat.
Then you test gag reflex, verbalize only.
So we verbalize that. Next.
Neck inspects and palpates position of the trachea.
And so we're basically here again inspecting just to make sure her trachea looks midline in the middle. Okay. Next.
Palpates the isthmus and bilateral lobes of the thyroid standing behind the patient.
Okay. So I like to be behind the patient. Remember, we're going to find the cricoid cartilage and then go right below that to try to feel the actual lobes. The isthmus kind of sits in the middle. Okay. So remember, when we were inspecting, you can have the patient slightly hyperflex just to look. All right, at the neck, trying to examine it, and then the patient can go into just a slight forward flexion, not much, right there when you actually palpate the actual thyroid. So find a cricoid cartilage, go right below that, have the patient swallow, and you're trying to feel the lobes. Remember, you can give the patient a glass of water, so you're feeling for any nodules, any enlargement, those types of things. Looking physically for and you're expecting like a gourd or something like that, which you won't see in many countries unless they have iodine deficiency typically. But,
Lymph nodes, palpates preauricular.
got them, I got them all.
Okay.
So we're gonna go occipital first. This is the best way to do it. Occipital, okay, postauricular, preauricular, tonsillar, submandibular, submental, one hand, anterior cervical. Remember those are chains, okay. Posterior cervical, okay. Now for this, if you can unzip your coat just a little bit. Now what do I ever do to expose these cervical, supraclavicular ones? One, if she kind of hunches over like this, if she's willing to do that, if you'll notice, it makes these like pits right here inside above the clavicle. That allows you to really get in there and go across. Okay, you can relax. And then I'm gonna stay on the outside of her shirt because she's a female for this purpose, and do the infraclavicular ones across. Okay? And that concludes the exam. If you have any questions, wash my hands, whatever. Give her a big hand clap because that was a hard one to be a volunteer for.